country's coronavirus commissioner, Professor Ronni Gamzu, is now making an address. Let's listen in.
Today we went a step higher. It's very bothersome, but let me describe first, in the first stage, the situation of morbidity in the state of Israel. We see a very high rise of the number of cases, of new cases, in the Haredi ultra-Orthodox sector in the last week. After the Haredi population, with a great effort, 1 week after another, and with success, managed to reduce the level of morbidity. It went up again in the last 10 days in a way that's very bothersome. Some of it has to do with the outbreak or positive results in the yeshivas, in the religious schools, but some of it is in the community itself, within the communities of the ultra-Orthodox. It's very difficult for all of us, of the leaders of the communities, how to cope and how to reduce the number. Yesterday I visited them. I know all the communities. I spoke this week with the mayors of various cities of the religious ultra-Orthodox. They're doing their best. And actually the need is great, with everybody's help in order to reduce morbidity. The review that we're doing for the yeshiva students is to give them security to continue studying. The rise that we're seeing, we have to connect it to the beginning of the school academic year and to the end of the period where there are a lot of events within the Haredi community. But at the moment, we see a very significant outbreak, very bothersome for all of us, and we have to do everything, all of us together, in order to help the Haredi community to reduce morbidity. The rise in the morbidity in the Arab community is continuing for the last 3-4 weeks. It's continuing, and I think that the Arab society has to understand very, very well. You have to stop completely with the complacence, with the indifference, and I see it there. I visit a lot the Arab communities, their villages, and I see again and again, they do not internalize the fact that a wedding is an infection event that continues to the families, to the community, to people. And it goes from one village to another, and the morbidity is rising. By the way, we see a certain rise also of the general population. We see it in some cities, mixed cities, in the neighborhoods. I went to the city of Ashdod. I sat with the mayor and all the people there, but morbidity that is climbing in one day from 2,100 to over 3,000 cases. That should worry all of us, and it's worrying me a lot, because that's the place where you're afraid that you're getting to a very, very critical period. And just remember, the school year opened yesterday or 2 days ago throughout the country. And although some people say it's okay, we know that the education system can cause the rise in morbidity, even if they do it in a safe way. So that's what we have today. Together with that, this week we did manage to pass the bill of the traffic light plan, which helps us to grade the villages according to the level of morbidity. And I insist, the traffic light doesn't end with the colors. It is a tool to give us capability, all of us together, to navigate our intervention, our steps in a way that are not just general, that cover the entire state of Israel, but focusing on zones of morbidity. It's the steps, it's the management, the intervention, the support, and the help to all those cities, red zones. It's not a stigma. It shouldn't be a stigma. Red zones, it's places where we want to give more measures, more possibilities, more intervention in order to help them get out of this circle of morbidity. More help. I directed the Home Front to give all the assistance, the tests and investigations and management to all the red zones. This is the way we see it. And those red zones, together with the management and our census, can cope. But it's not enough. And unfortunately, the level of morbidity in red zones compels us to do additional steps. And unfortunately, yes, we made a very unpleasant decision regarding the education system in all the red cities. Why do we need additional measures? Additional measures of more limitations, whether it's just modest or a real lockdown, or maybe steps of limiting trade and businesses and life and gatherings and extracurricular activities. In a city with high morbidity, first of all, we want to assist. We want to assist the mayor and assist the inhabitants to reduce morbidity, because we can't always reduce their morbidity only by personal steps of each of the inhabitants. You need things across the board for the entire city, and the mayor doesn't have these tools. We have them, the government. These tools are the recommendations that I give to the government. And the tools that I use, I recommended to the government and the cabinet of the Corona this afternoon, is to apply a lockdown on a few red cities, which includes also limitation of movement within the city. Yes, and closing the schools, the education system, limiting businesses and trade within the city. These are very, very harsh limitations. And I wanted to limit some 10 red cities. That's what I submitted to the government. The government extended the mandate and gave me the possibilities to talk to the other cities and to check and to see what additional zones are fit for those limitations. The other cities that are not going to be limited, in the red zones with high morbidity, we're going to have a night curfew, a night lockdown. Yes. There's no choice. And yes, of course, closing the school system. These steps and measures are very difficult for every city, for every inhabitant. They're very difficult for me as well. Very difficult for the Corona cabinet, who deals with that for many hours. But when we see the outbreak, prolonging outbreak, such a large number of cases and no control of ours or the cities, we have no other choice. Another reason that we're limiting people on a full lockdown to a city, to such a red city, especially in cities where there is a large scope of movement, a lot of activities, is the mere fact that we know and we see, and it is proven day in, day out. Such a city causes morbidity in other cities because of the movement from it and to it. And we see how the morbidity transfers from one city to the other, especially in the Arab sector, in the Arab society, especially in the Haredi society. We see it. It's happening from one city to a mixed city, or even to a religious neighborhood, from Bnei Brak and Modi'in to neighborhoods in Ashdod. We keep seeing it all the time, and this is actually directing us to infection or morbidity throughout the state of Israel. And when we will have to face these numbers, we won't be able to control the situation. This is the minute that the hospitals are going to collapse. And therefore, our goal at the moment, at this point, is to contain the spread. This is our goal. And in fact, we are required to measures that we are applying with a heavy heart. Look, to my mind, all Israel is at war. A red and orange and yellow and green city. All Israel, all of us, we have to help one another to get out of this situation. But there are cities that are more in the forefront. And the efforts that we invest over there and the measures that we have to apply are different from a green or yellow city. But every city, green or yellow, should remember that we see such a rise in mobility and these cities eventually become red, and that's where I want to stop. That's where I want to stop it. Because I know that at the end of the day, the large numbers are outside of these sectors. They are also with the people who are elderly. And when it gets there, we are going to be really in a very difficult situation. And that's the first phase. That's what I'm trying to do, and that's what I asked the government to do. I want to say, yes, this is a very difficult moment of the fight against the coronavirus. Very difficult. To me, to the cabinet, to the prime minister, the minister of health, all the members of the cabinet. These are very harsh decisions with people who are responsible to you, the inhabitants. It doesn't matter which city, whether it's from the Haredi society or Arab society or the general population. These are very, very harsh decisions, and I want to focus on a few things. One, we are all together in this situation, all the ministers, all the politicians, all the leaders, prime minister, all of us together. And in fact, sometimes, you know, people are giving me blows from here and from there, but I ask, really, we are an event of a war. It's an event of a war, and I ask everybody to be behind the government and the cabinet as one body to support these decisions. Because ahead of us, there are more difficult decisions. Yes, we will have to continue and to see what's going to happen in the next few days, whether the mobility continues. And this is a message to the entire state of Israel. Please, no weddings today, no mass events, no gathering, which is illegal, no underestimating any restaurant anywhere. There are cities in the state of Israel that in the next week they're going to be in a lockdown, in a closure, and very difficult economic and socially and mental difficulty. Everyone who doesn't put on the mask and belittles all the other things, to my mind, he spits in the face of a doctor or a nurse who work around the clock in the corona wards, in the hospitals. And I'm sorry that I feel that I'm so excited when I say it, but this is a groundbreaking moment in this event. I want you to continue to take care of the elderly. I want you, the elderly of the people of Israel, the state, please take care of yourselves. Continue to take care of yourselves, really, together with the families, but please take care and don't get yourself into complacency. I want to see many less figures of elderly among the sick cases. And again, I want to say, first of all, thank you for the trust that I got in the cabinet. Yes, there were difficult and harsh decisions. Not all the ministers agree with these decisions. I know they're very difficult and harsh. And I want to say thank you to the Prime Minister and to all the members of the cabinet and all the ministers for their support of me with all this complexity in the decisions. And before I give you time for Q&A, I want to say thank you to all the physicians and the nurses, the hospitals and all the medical staffs, the HMOs in the communities, in the geriatric centers, all the people who take care of the Corona patients and help us to continue this event with most of the state of Israel functions. I want to ask anybody, any person who is in a green city to think that as of next week, there are people who are going to be in limitations in other cities. I don't want to see you underestimating. I don't want to see you belittling. I ask you, we're one state, one people. And all of us have to guarantee one another with all the complexity. Also the Red City, with all the complexity that they have to go through, we have to be solid, to show solidarity with all of them. I'm going to go from one city to the other in order to show my support and my responsibility towards them, and of course the fact that they're part of us. I will now answer questions with your permission. What if the lockdowns on the religious sector won't be enough and you'll have to do it in the whole country? Of course, this is a reasonable chance. It can happen. We have to do everything possible so that this possibility will go far away from us, because it has a lot of ramifications on the society, on the economy, and we have to help those red cities to get out of this situation. The more they get out of this situation, we are going to avoid a lockdown for the entire country. What's the red line from a number point of view? I always said that this is a combination of the number of the cases and also the situation in the hospitals. Today, I finished a conversation with the barometer team. They're still describing a stable situation in the hospitals, 420 severe cases, but we have 13 dead people a day, and the staff is getting tired. So it's a combination of both these things. I don't want to say numbers because it's a lot of discourse. We have to go into details. I'm going to have conversations not just with the barometer team, with all the doctors and all the nurses who work in the wards of Corona, with all the managers. And of course, I'm helped by the entire team of the Ministry of Health. So the decision is much more difficult than just giving you a number. Are you preparing to have a full lockdown on these cities? As for the lockdowns in very severe cases in the cities, we had to create some sort of a grade or a scale of the numbers or the rate of infection. I can't decide by myself. In order to create limiting zones, you have to have a government decision and also regulations that the Knesset has to approve. And the government now approved those cities, but from this moment on, as of Monday, we had the possibility to start applying differential limitations on various cities in an organized way, and the traffic light and the scaling was created. And this is how we created closing of schools in red cities, and now we're going to the next scale. I said the moment we approved the traffic light plan, it's not just one layer. We're going to have another layer above it. These are limitations that I cannot put into plan. It's talking about movement and closures, and according to the Corona law, there's a special ministers committee to deal with it, and it's not automatic. And according to my recommendations, I would make it even if we were not in 3,000 people a day, even 2,000 and above. at that level, I would also ask the cabinet to apply limitations and restrictions. Do you think that within the week, until the decision of next week, we'll see any difference? No. The traffic light plan and these restrictions do not have an effect of 1 week. The main goal of ours at the moment in these restrictions, these limitations, are preventing spread and also helping the cities to reduce their mobility. These two things, I expect that we are going to contain this massive rise that we saw, and I'm also expecting to see containment of the spread to the other cities. These are the main two things. A week, will that be enough? It's very, very scarce. But what I want to see in the next week is whether there is an infection or any effect of opening the school system on the cities, on the other cities in the state of Israel. This is my follow-up, day in, day out in the next week. If you find out that these lockdowns on zones did not succeed, then what? Look, what you're describing now, I'm now describing a prolonging advancement, and I'll see it going into all the cities in the state of Israel. A spoiler, yes, for sure. The moment there'll be a situation of a prolonged advancement that doesn't focus only on the red cities, and already we saw in the passing from one day to the other, we have more people added, more red zones. You have to understand what the traffic light is. The former method of coloring the cities was relative. Every time somebody else was red, but it did not describe the advancement of the mobility. The traffic light is an absolute method. It describes the advancement of the mobility, and that's why we have more red cities. It's not that this is red relative to the orange, because the orange will become red, because we have a constant situation throughout the country. And yes, maybe we'll wake up next week with 60 red zones. And there, of course, we'll see this prolonged advancement. And of course, this is a situation that says lack of control, and that will compel us to a lockdown. What about the list of the burning red cities? The list is already there. The list is already there. All the red cities are in the list. In what cities you apply, what kind of measures do you take? Because the law compels you to discourse, first of all, with the mayor. First of all, you have to consider their elements, to consider the capability to enforce the scopes. It's not that simple to just apply a lockdown and another one on 30 cities in the state of Israel. We will need the cooperation of the inhabitants. And here, actually, you have to consider the main goal is to reduce morbidity. You see the depth of morbidity, and the other goal is to prevent the spread. You're looking for those cities, large cities with a lot of movement, a lot of dispersion, people coming in, coming out. This is a process of decision-making, and I started doing it together with the heads of the authorities. I will continue to do it with them. It's always in a discourse. I listen to them, I hear their opinions, and then I give a final recommendation to the government with all the reasons. This is the way. That's what the law compels us to do. Do you think that the measures that you take today will dramatically reduce the mobility? I think I answered that. I think that the measures of lockdown on 8 or 10 zones and other measures will bring about the reduction of mobility. Dramatic? I don't know what you mean. What's dramatic? 50% less? No. If you say dramatic, that you stop or you reduce the rise, then the answer is yes. Is this the only way to do it? There are no other ways to do it? I think that in this conversation, you understand from me that if we see that there's no containment, there's no reduction, then we will have to take more measures. And you remember my outline, which I presented 3 weeks ago, is an outline that said we will need to take a testing point, and that was the 10th of September, in a week from now. We didn't just choose a date. It was chosen about a week or 10 days after opening the school system, and 3 weeks after that in the Haredi community. Did that make a difference? I think yes, and I said it, and that's why I fought so hard to shut the school system in the red cities. Whether this outline of the school system in the general population is an outline that I'm sure will cause a rise in morbidity? No. Believe me, if I was sure, as others are, I wouldn't work for that. I would fight against the school system. But most of the experts told me this is still safe. Next week, in the next few days, we will have a point of decision towards the 10th of September. We'll have to see what's happening with the entire population. And I reiterate, definitely in the general population, but all over the country, we are in a testing point. If I don't walk around, even in Tel Aviv, which is green, and also in the Arab cities, and I'll see one wedding with a mayor, if he will enable one wedding like it was yesterday in the city of Rehovot, this is not okay. And I'm saying it very extremely. It's spitting in the face of a physician and a nurse in the corona ward in the hospital. I do not want to talk about attacks. It's not pleasant.